So now it's 7:05. I think probably we should get it started. You know, with some people joining in later, you know, they could feel free to do so. So welcome all of you joining the Ways to Refuse Dangerous Work during the COVID-19 webinar organized by the Occupational Health Center. My name is Tiffany Powell. I'm the moderator for this session this evening. So we are so pleased to have Blaine Duncan and Bernie Wood to present for us today. I just want to introduce them. Bernie Wood is the health and safety activist who belonged to the United Steelworkers Local 6500 for many years and recently served as the Canadian Labour Congress Manitoba representative. Blaine Duncan, he is currently the Safety and Health Specialist for Manitoba Government and General Employees Union. For the first part of the webinar, you will see Bernie and Blaine are going to present for us, and then followed by the 30 minutes Q&A section. So for you participating in this session, you could see that the host has already muted all the participants. To ask you to, if you want to ask questions, please click raise hand, click the participant icon along on the bottom of your screen. The menu of the raise hand will be popped up, and also you could find it on the right side in your chat box session. Click on it, the raise hand, then we will see you, and I will try to ask you to unmute yourself to talk in order. If you don't want to speak on the screen here, you could even try to type your question in the chat box. Then we will try to answer your questions. We may not be able to answer all questions in the Q&A session, but we will try to send you back the answer later on if we can't. So for the whole session is going to be recorded, so we're going to sharing it on our website and the social media. So without further ado, I want to welcome Blaine Duncan to first, make the presentation for us.
Awesome, thanks, Tiffany. So as Tiffany mentioned, my name is Blaine Duncan. I'm a safety and health specialist with the Manitoba Government General Employees Union. My tenure with MGU is coming up on 20 years, so I have a fairly extensive background with the membership that MGU represents. Prior to that, I was a member of MGU. I was a workplace safety and health officer in rural Manitoba and was regulating the Workplace Safety and Health Act and regulations. And previous to that, I was doing some private consulting and much like many of you, worked in private industry, for a private employer who often struggled with safety and health issues as well, and that's sort of where my interest in safety and health got started. So I'm pleased to be part of this collective. I'm glad everybody is here. It's a large session. It's also incidentally the first time we've tried the Zoom presentation format with one of these presentations. So Tiffany and I tried it this afternoon, and hopefully everything will go good. We've got some trickery we're going to try with flipping between slides and websites and whatnot, but hopefully this new electronic format works well. Towards the end, we'll allow an opportunity for some questions, as Tiffany said. We did receive one prior, so we'll use that as a mechanism to sort of jump into some questions. But I think first of all, we wanted to spend some time talking about COVID itself and some of the ways in which it's transmitted, so we get an understanding of the disease itself. And then I think talk about some of the traditional approaches we use to deal with safety and health issues. Whether it's infectious disease or whether it's any other type of concern, there is a standard approach to dealing with safety and health issues, and dealing with COVID should be very similar. So we want to put it in a format that is familiar to you and give you some ideas as to the kinds of things you should be seeing in your workplaces as you continue. If you're one of those frontline workers and haven't been away from work, thank you for all of the work that you've been doing. If you're a worker who is transitioning back to work, then you'll likely notice that work is a little bit different than what you had left some weeks or months ago, and for good reason. And so we'll talk about what some of those changes ought to look like. And we'll have to talk about things in some generalities. Each of your work settings might be somewhat different than the next, but we'll talk in a sort of general context about what you should be anticipating and seeing. in your workplaces to give you an idea of whether or not your employer's done appropriate things, and whether or not you need to engage them in some sort of discussion or potentially approach that particular scenario from a right to refuse perspective. I know that was in the title of the presentation that probably drew your attention. And so we will talk about the process of exercising a refusal in the context of COVID. However, to be clear, it doesn't change from any other circumstance in which you might exercise a right to refuse. So we'll make sure that you're familiar with the process. And as well, the Workplace Safety and Health Branch has published from their perspective how they would adjudicate a right to refuse in the COVID setting. So we're going to make you familiar with that particular document and where its location is so that you can perhaps use it down the road. So I just want to talk a little bit about the Occupational Health Center before we actually get into the material. Many of you may know that the Occupational Health Center has been in Union Center on Broadway for many, many years. We're excited about a move that's coming in early August. They're going to be co-joined with some other supportive health services at a facility on 167 Sherbrooke, so not too far away, still fairly close to downtown. And we looked at the synergy of that particular matchup, and it's something that we're excited about. Hoping to have a bit of an integrated service delivery model with some of the other health providers around occupational health and whatnot. On this particular slide as well, there's references to the Occupational Health Center website and some material specific to COVID. I won't take you there right now. We'll probably end up there towards the end of the presentation. We will likely have some questions and concerns, not only around right to refuse circumstances, but what if a worker has some vulnerabilities and they're not able to work as a result of those things? Some of the questions that have arisen before we set up the webinar were in relation to what kind of benefits are out there in terms of wage and benefit recovery. And so, although that's not my area of expertise, we'll draw you to some resources that can help you sort of find your way through those things. This is a new and changing world, it seems, in the last couple of months. We've seen lots of different benefit plans come about. We've seen public health orders change over time. And certainly now, as things are reopening, we're seeing a loosening of some of those particular standards. So lots of information out there, almost too much to wade through and understand, but we'll try to make sense of it before the end of the presentation. My affiliation with the Occupational Health Center is I sit on the board of directors. And I have to say, Tiffany present, and there may be others who are watching, it's a fantastic organization with incredible staff. I encourage you to have a look at the website and the work that they do, the diversity of work that they do in supporting workers in Manitoba. It is the only occupational health center in Manitoba. It is the center to go to if you have an occupational injury or illness. It is held in high regard, and just to sort of demonstrate that, not only by the participation here tonight, but through this COVID pandemic crisis, Dr. Alan Kraut was chosen to lead the occupational side of things in terms of leading folks who are developing guidance materials and standards with respect to potential occupational exposure. So Dr. Alan Kraut is one of the medical practitioners at the center, and is certainly is held in high regard in that fashion. So thank you to him for being a lead on those things and continuing the efforts of the center. I'm just going to steal a moment too to plug Safe Workers of Tomorrow. It's another organization in Manitoba that provides training to young workers and new workers. They're sort of the lead when it comes to the youth strategy here in Manitoba. They participate along with the Federation of Labor in being part of this collective that works in improving safety and health standards in the province. And so we want to thank them as well for being part of all of that. And again, it's humbling to be invited to these kinds of sessions and be able to present on those things. And thank you to you all for again participating. So I'm going to do my best to walk you through a couple of slides. And Bernie, feel free to jump in as need be, or Tiffany. This next slide deals essentially with the disease state itself and how it's transmitted between individuals. And in reality, that's what we're concerned about. We're concerned about how people might be exposed to this viral material. And essentially, when you think about, a little bit comical actually, when you think about Justin Trudeau's, the Prime Minister's commentary a few weeks back when he talked about moistly speaking, the reality is that the viral material that we carry in our bodies, one of the way that it is spread is through the emission of these droplets that come from our mouths and our nose when we sneeze or cough, and the fact that they will leave our bodies and move towards others if they're in close proximity. And so we need to think about this droplet transmission that occurs. The size and the density of these droplets, if you look at some research material, and there's some debate around this, with respect to aerosolization and whatnot, but the common theory is that these droplets are of a certain size and density that allows them to drop out after a short period of time and after a relatively short distance. And this is where this concept of that 2 meters of social distancing comes from. And so this is one of those principles that we want you to think about as you're in your workplaces and you're watching for potential exposures. Are we maintaining that social distancing? And if we can't, then what other kinds of things should we be putting in place? The other thing that happens as a result of those droplets leaving our bodies is that they fall out on surfaces. And again, there's some controversy with respect to how long those droplets contain viable virus. But if we touch the surface in which those droplets have come in contact with, within a relatively short period of time, there may still be viable virus in those droplets. And we may get them on our hands, and then we have a tendency to touch our mouth and our nose and our eyes, and that material can then be deposited in the mucous membranes of our body. And so that's the contact transmission hazard that we're concerned about. And so, there's been an emphasis on hand washing and sanitizer. In some cases, there's glove use. And then there's other precautionary measures that we also implement in terms of, masks or moving on to some kind of respiratory protection. We may see in certain workplaces the use of protective gowns and those kinds of things. And so those are the kinds of things that we want you to think about, but we want you to think about them in terms of a hierarchy of control sort of way. Whenever we ask people to think about controlling a hazard, we always talk about, can we provide for an engineering control, which is much more favorable than an administrative practice, which is essentially asking somebody to behave in a certain way. And sometimes we don't make the best of choices and we end up exposing ourselves because we haven't followed a particular protocol. The best control method is an engineering control. The least desirable method would be personal protective equipment. And again, through the pandemic, we've seen a fairly large emphasis on the use of gloves and eye protection and some form of mask or respiratory protection. And so we'll talk about those things in terms of the kinds of things you should be seeing in your workplaces. There are a couple of additional things that we need to think about in terms of transmission. And unlike some of the viral material that we are familiar with, and there has been some comparison to things like the seasonal flu, we don't know, I think, enough about this new coronavirus to make really concrete decisions about how infectious it is, when it's infectious. And so we're still at a bit of a loss in terms of when somebody becomes exposed to it and whether or not they actually become symptomatic. And even more complicating is, if they're not symptomatic and they don't realize they have the disease, they could be spreading it to others, or they could be spreading it during a period of time in which they're not yet showing symptoms, and they may at some point down the road show symptoms and realize that they're sick. But those things sort of complicate matters for us. And so we want to make sure that people are heeding those public health best practice guidelines to ensure that we're also compensating for the unknown. So I'm just going to change the slides here if I can, and it worked, so that's good. So as I said, we want to think about things sort of in this progression, right? The droplet and the contact precautionary measures would include things like physical barriers. So what are we seeing out there in terms of physical barriers or engineering controls in a lot of workplaces? Plexiglass, whoever's manufacturing plexiglass is probably making a ton of money these days. Plexiglass showed up out of nowhere in a lot of workplaces, and it creates that physical barrier between the customer, the client, the people that you deal with in your business, and your workforce. And that physical barrier is there to establish some physical distancing between the parties, but to also ensure that there's a barrier so those droplets that are being emitted while you're talking, coughing, or sneezing don't reach the other person in close proximity. So that's an example of engineering controls that we're wanting workplaces to primarily start with and ask themselves, is this something that they can reasonably implement? And then sort of secondarily think about, are there some practices, again, in the safety and health world, we sort of talk to them as administrative controls, but there's a whole host of things that sort of fall in there with respect to COVID. The first that you're probably most familiar with, it would be the social distancing aspect, right? Making choices to stay that 2 meters or 6 feet away from each other as much as we can. Ensuring that we're washing our hands regularly. As I said, if those droplets are dropping out on surfaces and we tend to touch them and then touch our nose, our mouth, or our eyes, there's a transmission potential there. Are we regularly sanitizing our hands? Are we regularly cleaning the work environment to clean those contaminated surfaces? So putting those practices in place through good choices that we make. And then we're moving on to things like eye protection. Eye protection, we may not have necessarily thought of before in terms of infectious disease control, depending on the work environment that you're in. But if you look at healthcare, eye protection is a huge part of the protection measures that they put in place. And again, that's to try and avoid those droplets from entering our eyes. Masks, I've added respirators in parentheses there. Masks really aren't personal protective equipment, right? They're not protecting you from other people. If we're looking at the cloth masks or other non-regulated masks that people are wearing, it's actually preventing the droplets that you might emit when you talk, cough, or sneeze from really leaving that material and moving towards somebody in close proximity to you. Whereas when we look at respiratory protection, like the N95s that have been talked about a lot in the last couple of months, and we've had lots of concerns around availability of those particular devices. Respirators are designed to protect you from the environment itself. And so that would protect you from respiring or taking in viral material. Many of you may have seen the controversy around when are N95s required, shouldn't we all have them? There's been pretty much a consensus that N95s are required for what's referred to as aerosol generating medical or dental procedures, so AGMPs or AGDPs or AGPs, what different acronyms you'll see. And the reason that they're being sort of limited to those particular procedures is that those procedures create very small particles that will drift much farther than the regular droplets that come out when we speak or cough or sneeze. They're very light, very small, and can travel farther distances and hang in the air for a longer period of time. And so they require a different level of protection. And so that may be why we've seen this reference to N95 or greater protection for those particular procedures and not just the everyday sort of interactions that we have. And then, as I mentioned, we may see other protective measures in place as well, particularly where people may be interacting with those who are suspected of having COVID. Somebody has symptoms or they're a positive case. So again, some healthcare workers are required to wear eye protection, N95s, and gowns, disposable gowns, in those circumstances where they're dealing with patients who have COVID or are suspected of having COVID. So again, those are sort of the regular protective measures that you're going to see referred to and are applicable to most work environments. And again, sort of going from physical barriers down through gowns, you'll see that we have sort of listed them in the order of engineering controls, administrative practices, and then last but not least, the personal protective equipment. So keeping in mind the transmission modes and these various types of protection, I think we can start to talk a little bit about the right to refuse and what might lead you to a right to refuse should you recognize that there's that potential for exposure because those measures aren't adequately in place. And so we have some references here, two from Safe Work Manitoba. The first one just deals with the right to refuse in terms of general concept, and the other does make reference to COVID as well. And there is another link to a site that has the Workplace Safety and Health branch, so the regulatory body here in Manitoba that administers the Workplace Safety and Health Act and regulations. That body itself has developed material to provide some direction with respect to expectation. If you're going to exercise the right to refuse, what does that look like? How do they deal with it? And so we'll get a chance to look at both of those things. Bernie, did you have anything to add at that point?
No, we could definitely go through the steps for the right to refuse, or we can, if you're going to throw the link up, that's fine.
Yeah, I will try to do that. Just have to back out of this for a second.
I'm going to go through it anyway, but
I'll just get it up on the screen for us so that
sure,
people see a visual. Nope. Bear with me for a second. There we go. Can you see it?
perfect. Yeah, so I mean, in like step one, it's very important for the worker to make sure that they do report any unsafe work to their supervisor immediately. In my experience and working with workers and other committee members, it's also a great recommendation to make sure that you have that you're in the presence of either a worker rep or an advocate or a committee member when initially reporting, even at step one. And if at that time the supervisor or management or the worker and the employer are going to assess the unsafe work, and at that time hopefully come to a consensus or some sort of a remedy to that. But if not, then you move on to the step two there. If there wasn't an agreed upon resolve to the dangerous working conditions, then at this point the worker rep must be involved, either from a committee or at least a chosen worker from the worker that's refusing. Make sure that they're the ones choosing. And then at step three, at this point, if it's still not an agreeable resolve, then what needs to happen is workplace safety and health needs to be called. And at that time, the workplace health and safety officer would come in, they would have some conversations, do an assessment themselves, and determine whether or not at that time the work is safe. And they would make the determination at that point. So that's kind of your three steps to your work refusal, and it's really important to make sure that they are being followed and they're being followed in order, because it's your rights, and it's super important. In my opinion, too, you try to do everything you can to avoid the third step, because a lot of times what happens is a workplace health and safety officer may come in. They may not be familiar with your work site. They may not be familiar with the work you do. And at that point, what it is it's very important for you as the worker or the rep that's representing the worker to kind of paint a picture for the workplace health and safety officer. And at that time, what's happening is the employer is also painting a picture for the officer. So if there's a way that you could deal with this at a committee level, or at least through the worker representative and yourself before getting to step 3, I would say it's very important. But if not, and if there's even a shadow of a doubt that you still may not be fully safe, then absolutely move on to step 3. And then going into the COVID, the process for the COVID, it's the same. It's your right to refuse is the exact same. You need to make sure that there's the employer has those engineered controls, such as like Blaine mentioned, plexiglass. Also have seen like segregated or separate workstations. They've created different buildings or spaces in the rooms. And then there's also kind of behavioral controls that could be put in place as well. Things as like staggering breaks. Also, when leaving break rooms, that there's sanitization methods being done, and also when entering them to ensure not just your safety but everyone's safety as well. Like Blaine also said too, I mean, PPE is the last control, but at the same time, the PPE with COVID has also become a first method, and a lot of people are feeling comfortable wearing the masks, the gloves, and things like that. So those are becoming mandatory in some workplaces as well. Although when you get working in things like construction sites and stuff, wearing like medical gowns or shields or latex gloves or anything like that, it's not ideal, and also not, it creates its own safety hazards as well. So that's not something that's really being done. But the non-medical masks are becoming something that everybody's wearing, and they're relatively accessible too. Not saying that I recommend that everybody wears them or not, because I don't have an opinion on that. But as far as the right to refuse, like I've been doing this a long time, and I see no difference. It's really important that the employers and the employees and the workers understand what their roles are, and the importance of keeping themselves safe, and that the employer does have an obligation as well as the workers have obligations. So that's what I would like to add about the steps. Yeah, that's all.
Great, thanks, Bernie. So just on this particular page that's developed by the Workplace Safety and Health Branch, they make some references to how they would view a right to refuse, and these are some of the things that they say about how they consider work to be dangerous. So it says, it's important to note that a danger to safety and health is different than a risk to safety and health. In order for something to be considered dangerous, it says the hazard is generally unusual to the normal working conditions or tasks, or the health and the physical condition of the worker increases the risk. And so the question we're going to deal with later does talk about a medical condition that a worker has and how it might be impacted by potential exposure. And if they do contract COVID, the symptoms might be more severe. And so that is contemplated as part of this mechanism of exercising a refusal. You may do it because you're at increased risk because of a medical condition that you have. They also consider that the hazard is likely to result in a serious injury or illness. And again, so if you can demonstrate that, and it might be difficult at this point to demonstrate, but certainly the fear is there, and the unknown is problematic in this, is that strangely, some people are carriers and asymptomatic. In other cases, people are carriers and within about a 24-hour period, they're on a ventilator. And so I don't think it would be easy for anyone to really adjudicate and say, if you get this, it's unlikely that you're going to become ill. There's such a variance in terms of how people react to this. And we certainly want to protect all people. And then it says, thirdly, are reasonable controls in place to reduce or eliminate the risk? And that's why we wanted to sort of process with you what kinds of things might be implemented in the context of your work to allow you to think about, has the employer made attempts to protect me, and are they reasonable attempts? And if they haven't, certainly that meets the criteria here that they failed in their responsibility to provide for a safe work environment. In the refusal process, a worker can't be discriminated against for exercising this right. So let's be clear about this. It is a process, a legal process. It's Section 43 in the Workplace Safety and Health Act. Get yourselves one of these books. They're handy reference guides. Section 43 is a prescriptive process. It has to be followed in the manner in which it's described in the legislation. And it doesn't allow an employer to discriminate against a worker. If a worker has reasonable grounds to refuse, as we just said, if they believe that they're at risk of transmission, essentially because the employer hasn't put in place protective measures, they have the right to exercise a refusal. And keep in mind, you're not likely refusing all of the work. You're probably refusing a particular aspect of your work. And so, as Bernie said, you want to try to work through that with the employer. If they don't satisfy those concerns, you have the right to refuse that particular work. And in doing so, you shouldn't fear any sort of retribution or any sort of punitive action or discrimination as it's described in the legislation. So this next point says, do workers continue to get paid during a work refusal? Yes, they do. The employer would be seen to be discriminatory if, in fact, they said to a worker, we're more or less done here, you go home, and they don't receive pay for the time that they're away from work. The idea is that the parties work together and find a mutually agreeable way, a consensus, to satisfy the safety and health concern. This should not simply be about removing one worker from a particular work setting because they have a concern and substituting another worker into that. So the second point on this page says, can another worker be brought in to do the work? Another worker can, but that worker has to be informed of the concerns that the initial worker refusing has. So if the initial worker refusing says, just as an example, we work in a grocery store, and I've seen lots of other grocery stores where there's a piece of plexiglass at the till to provide for protection between myself and the customers that come through, and we don't have that. There's an engineering control that has failed to be put in place. You may exercise a refusal because of that. Your employer may go to another worker and say, Blaine is refused because of these things, or they may not. The legislation clearly says that any subsequent worker has to be informed of the reasons for the first refusal. Preferentially, that communication has to happen between the worker that originally refused and any subsequent worker that is asked to perform that work. If I'm not available any longer, as an example, I may go off of shift, or perhaps the employer has sent me home. They have to have a mechanism to be able to inform subsequent workers. And that should be in writing. I should be able to write out my reasons for the refusal so it's not miscommunicated. That information should be shared with subsequent workers. Those workers can choose sort of their own fruition whether or not they want to do that work. So it's an individual right. It needs to be an informed right that I need to understand the circumstances that might put workers at risk, as described by that original refusing worker. And then subsequent workers would then make a decision based on that. Of course, as labor, we would advocate that if a worker refuses, it's likely all workers should refuse that particular circumstance. We want to see our members stand together in this process and not undermine a coworker by suggesting that their concerns are overinflated. We want them to see the true safety health concern in those processes. Can the refusing worker be assigned to other work? Yes. So I, as the original worker refusing, could be told to go and do some other assignment that I don't have safety and health concerns about, that I continue to get the same pay and benefits that I would normally get. At that point, the employer may decide to seek assistance to resolve the original safety and health concern. Or they may go to, let's say, Bernie and say, hey, Bernie, Blaine has refused this. We've sent him over there to do something else. Do you want to do this work? And at that point, Bernie does, again, need to be informed as to the reasons for my refusal. And then it would be his decision as to whether or not he wants to continue in that work. So at various points in this process, there are some forks in the road. But at each of those decision-making points, the information should be presented to the worker so that they can make an educated and informed decision. And again, on this document, you'll see there are some guidelines for work refusals related to COVID-19. So some of the things that the branch has received in terms of concerns over the past have been things around, is there a confirmed or even a suspected case of the virus? Has one of your coworkers tested positive? Did they arrive at work symptomatic? What's the likelihood for other exposures to take place to those individuals who may have been ill while they're at work? And again, that's one of the reasons public health is really talking a lot about, one of the new normals for us will likely be if you're feeling ill, particularly with flu-like symptoms or COVID-like symptoms, you should not be around other people. And that's going to mean something very different, I think, for ourselves in terms of decisions we make about going to work on a particular day. But it's also going to mean some changes for employers who are going to have to accept the fact that in all likelihood, there are going to be more days lost to sick days than we've traditionally seen in the past. And if this is public health direction, employers are going to have to figure out how to deal with that. And we as workers are going to have to help the employer in that, because it's likely going to create some workload issues in workplaces where we're seeing a greater level of sick leave usage. So there are some questions around, is the workplace a known or high-risk source of the virus? So, if you work in a warehouse, you drive a forklift, you're social distance from your coworkers for the most part of the day. There's been no indication that any of your coworkers are sick or symptomatic. That's likely considered to be a low-risk environment. But if you work on a unit in a hospital that's been designated as a COVID ward, there's a much greater likelihood that you're going to encounter the virus in that circumstance. So again, within the context of the work that you do and the protective measures that are there, you're contemplating that risk level at various points. There's screening when you go into work. There's screening of the patrons, the clients, the patients that arrive at your doorstep to try and minimize the risk of that virus coming into your work environment and exposing yourself or other workers to it. And the same should be true as we go in the community. If you're a community worker, there needs to be protocols that your employer has established to be able to allow you to, first of all, be protected or have the appropriate protective measures in place or with you should you need them. But there should also be some way of screening the clients that you deal with so that you are informed before you are exposed to those clients. So it goes on to say, is the refusing worker likely to be exposed to the virus while performing the work? Again, that's one of the broad responsibilities of the employer. Infection control practices are a responsibility of the employer. Informing your staff about what those measures are is a responsibility of the employer. So it says, for example, does the work involve close interaction with many people or happen in a high-risk area within the workplace? Do you work in an emergency room versus work in a maintenance area? There are different levels of risk associated with those different work environments and your interaction with others. So we shouldn't let our guard down either. I just want to mention that the principles we're talking about apply to work settings. They also apply to the way you interact in the community and with folks outside of your immediate family group. As you may see in other jurisdictions, they're talking about cohorting with another family group or now 2 family groups. They're slowly opening that up, but we want to keep in mind all of these principles regardless of whether we're at work or whether we're in our personal lives. It also goes on to say in this document, says, does the worker have a pre-existing medical condition that places them at risk of serious illness should they be exposed to the virus? And is there a medical note? So we've seen over the last couple of months, physicians saying, we don't have the availability to be able to deal with a whole bunch of medical notes. So the advice of public health has been to employers, show some leniency with respect to those medical notes. Workers who have symptoms or believe they have exposure can go to the testing sites and be tested now. The opening up of those sites is allowing that. But over the last couple of months, the direction to employers has been, try not to force this need for medical notes, because the medical field just didn't have the same accessibility as they did previous to the pandemic. And I think, again, as Bernie said earlier, this should be an exercise in working together with an employer to try and find that, reasonable, safe place without requiring a medical note. We don't want to get pushed to that degree. Some employers may, in fact, do that. And we can talk about that in just a second as we talk about some of the scenarios that have been presented to us.
Rink. So now we got about 15 minutes left, but we started about 5 minutes late, right? So probably up to 20 minutes left. So would you mind, you could wrap up your presentation in about 2 minutes, then leave for the other time for the question and answer period?
Sure.
Thank you.
Yeah. So just, whoops, I'll come down here. There we go. I just want to make this last comment about sort of risk determination. Again, your risk can be controlled by putting in place the appropriate measures. And so it says, if the risk is high, if you're in one of those work circumstances where you're frequently in contact with people, in close contact with people, particularly in circumstances where this suspicion or confirmation of the COVID virus exists, you want to make sure that adequate hand washing facilities are available. And if hand washing facilities aren't available, then we're certainly expecting that the employer will have other measures to sanitize hands. And again, you go to the grocery store, and most likely there's somebody there making sure that you wash your hands as you enter the store. We would expect that workplaces have similar kinds of protocols in place. Again, if you're in a high-risk area, do you have that personal protective equipment available for your workforce? And so we've worked with employers over the last couple of months to attempt to ensure that they have those supplies in place. I know that there has been some hoarding that's been going on. Those who were able to grab a large supply of it in the beginning did so, and there wasn't necessarily enough to go around, or was in short supply. And so governments have had to sort of take control over procurement and try to get those things and make them available to those folks who need them. But that is a question. If you've put those other things in place and it remains a high-risk environment, should you move to personal protective equipment and having an understanding of what that personal protective equipment ought to be, and whether or not your staff understand how to use that equipment and what its limitations are in terms of control. So these documents are available online. Again, I would encourage, if you're within the province of Manitoba, Safe Manitoba or Safe Work has documents with respect to the right to refuse and COVID-related information. This particular document is published by the Workplace Safety and Health Branch, and it's related to, again, their expectation for the right to refuse process. So I would encourage you to look at those materials. I believe there are some people from outside of the province, so your jurisdictions, again, probably have information on the regulatory authorities' web pages or on industry-based safety program web pages, or with your insurance board here in Manitoba. It's the Workers' Compensation Board in Safe Manitoba. In your jurisdiction, it might be workers' compensation solely. So I encourage you to seek out this information in terms of guidance, and also get yourselves a copy of your Workplace Safety and Health Act and regulations as reference. They're online, but having one of these handy and taking one of these conversations can provide clarity around not only your rights and responsibilities of the employer, but guiding those conversations as well. So I'm going to stop sharing here and try to go back to, I'm going to try to go back to my Word document. Did any questions come in?
Is anyone here want to raise a question? Monica?
Yeah, I have one question. Sometimes at the workplace, you have to share some of the work items like printer and any other thing, phone, telephone instrument. And sometimes people who are asymptomatic, they don't have anything, even though you are maintaining distance and all that. But if they are touching the object and you're again going to touch the same object, what kind of precaution you can ask from your employer?
Yeah, I think one of the best things we can do is try to minimize having the people use the same items. If they can designate particular tools to individuals, then you minimize the chance of them becoming contaminated. If that is not available, then obviously you're going to have some intensified cleaning procedures between the exchange of those items between workers. Gloves might be something that the employer looks at, but the reality is your gloves can become as contaminated as your bare hands can. And so again, ensuring that potential viral material doesn't get on the object that's being moved. If you don't clean the item, if you don't wash your hands, if you don't change those gloves, and you exchange the item to the other person, there may be a transmission of that viral material in that regard too. So heightened cleaning practices is something that workplaces ought to be implementing if there are shared workspaces.
Thank you.
You're welcome.
So Dorothy, you're the next one raising the question. Can you unmute yourself?
So hi, Blaine.
Hi, Dorothy.
I'm going to be a pain in the butt and come after you gently about a couple of things that I think really matter in terms of understanding about this pandemic and how things are transmitted. You use the term, so the measures that people need to prevent folks getting sick depend on how the stuff is transmitted.
Right.
And you use the term droplet.
Yes.
You should know that those of us who do occupational hygiene and occupational health, you probably do know this, see aerosols, particles in the air, as sort of a spectrum that go from little bits to big bits. The droplets are what the infectious disease people call the big ones, and they call aerosols the little particles.
It's not that cut and dried though, is it? Like you say, there's a spectrum of sizes,
But B, there are probably at this point close to 300 papers out there that undermine this 70-year-old view of how things are transmitted, particularly viruses. And I just wanted to quote from one of the latest ones, which I got. So just so people know, I was the Occupational Health Center's first hygienist. I have been doing fact sheets for the Occupational Health Center about cleaning, working in grocery stores, working in meat packing, nail salons, what am I forgetting? Security guards. And I've been in touch with people literally around the world on this for the last 2 months, and I am super stressed out because of it. But one of the things that there's this huge debate about is how the stuff gets transmitted. And here's what the latest stuff says. That this is from a paper that just came out today. And they're talking about how the aerosols are what come out of our mouths when we sing or breathe, even when we breathe, cough or whatever. And so that's the smaller bits. Evidence from our work shows that exhaled breath emission may well be the most significant SARS-CoV-2, so that's the virus, shedding mechanism, i.e. the way it gets around, which could have contributed largely to the observed cluster infection. So if people have heard about these choirs where people got sick, or the Chinese restaurant and those places, and to the ongoing pandemic. Accordingly, measures such as enhanced ventilation and the use, and they're talking about face masks for the public, are essential to minimize the risk of infection by airborne SARS-CoV-2. So the face mask stuff is, there's all kinds of arguments about that. I've been part of an ongoing one today, but I think that 2 points there. One is that the little bits really matter. And so Monica, to your point about sharing things, it's not good to share stuff, but it's less likely that things are going to be on surfaces than if you're standing next to somebody and they're coughing, or even if they're talking loudly or whatever, and they're sick. You're much more likely to pick the stuff up that way. And one of the reasons for it likes mucosa, which are sort of essentially the wet membranes, which is why eye protection may be needed outside healthcare if you're around folks that might be sick. So ventilation is really important. I can refer people to the updated ASHRAE guidelines. There's a guy who's a guru about this has just put out some stuff I can share. The other thing is then that when it comes to respirators, what we call elastomeric, is a fancy name for the regular respirators with the cartridges, are actually recommended for healthcare because the N95s are disposable, and these other ones can be fit better. They last longer, they can be reused. There's none of this nonsense about can we clean them again and the fit and that kind of stuff. And I had some issues about the refusing, but I'll leave those. The other main point I wanted to make is there's a difference between cleaning and disinfecting. You have to clean before you disinfect. And if anyone's interested in the 5 active ingredients that are less toxic for disinfectants and which are available in this country, that's in the document that I've done for the OHC. I've got other things about it. So hydrogen peroxide is one that people might recognize. Citric acid is another, and there's 3 others that are.
What did you say? Hydrogen peroxide?
Hydrogen peroxide. And you need a disinfectant that has that in it as the active ingredient. The thing is that most of the disinfectants cause asthma. They have either bleach or something called quaternary ammonium compounds. You'll see ammonium chloride or something like that in it.
Dorothy?
Yeah, just 2 clicks, I promise. So they cause all kinds of problems. So there are other things out there, and that's one thing that people can really be asking for through their health and safety programs or committees, is to be using less nasty stuff. And I've got tons of stuff about that. Happy to share. Sorry I didn't have a chance to talk to you about this ahead of time, Blaine, or Bernie, but thank you.
I appreciate that, Dorothy. The depth of the material is incredible, and there was a balance of what do we share with folks, how deep do we get.
Yeah.
So I appreciate the clarification on the range of droplet sizes, and yes, the cleaning and the disinfection is a bit of a mystery as well. So.
Brink and Bernie, I got quite a few questions already raised here. I'm going to share the screen here. I put it on the Word document. Everyone could see the question. Can you all see the question on the screen coming up? So the first one is, if the only risk factor of the return to the workplace is that either the worker, the immuno and compromise of the family members, do they have the right to refuse? And then how's the physical distancing and the frequently wash hand and then enhanced cleaning, etc.?
Yeah, I think there's 2 questions in there.
Yeah.
One is in relation to the worker themselves, and the other is in relation to the family status, which would be a human rights concern. So dealing with the first one, an employer has the responsibility to ensure that a particular worker is protected. And if there is a susceptibility or a vulnerability, a medical condition that compromises that worker at a level at which most workers wouldn't be, the employer still has to provide for the appropriate measures to protect that worker. So in that circumstance, that immunocompromised worker may have the right to refuse work that they don't believe adequately protects them. The issue of the family member, that's a non-worker. And so some of you I know personally right now, I have a member of my family that's in chemotherapy. And so I wouldn't necessarily have the right to refuse work because she's going through chemotherapy, but I certainly have a responsibility to follow all of the measures that we've been talking about to minimize any potential exposure that I may carry to her. And in certain circumstances, if you're the care provider, as an example, you may need to talk to your employer about that vulnerability, that you can't be the one that is exposed and potentially bringing this home because you're the only provider of your loved one, whether it be a spouse or a parent or a child. And there are protections in the human rights legislation for those kinds of things as well.
Yeah, it's the family status accommodation.
So just jumping and looking into the second paragraph, this is what are the workers' rights and responsibilities? This is always sort of a touchy subject. Just how much information do you share with the employer about a medical condition or a life circumstance or a family status? You've got to share something. Like the employer can't be, seeing this through some magic ball, crystal ball, and they need to be made aware of it somehow. And so a worker's responsibility would be to share some of that information with the employer so that the employer understands the concern itself. Now, that should be the least amount of information necessary to achieve that. And the employer ought to be holding that information with confidence. They shouldn't be sharing that outside of the context of those conversations. And they should be accommodating to that worker. We want to see employers who value the contributions of workers and make efforts to maintain them at work. And by at work, I mean, it may be in an accommodated role. Instead of dealing with public, if that's your exposure in your workplace, instead of dealing with the public, perhaps you're in an administrative office away from the public. Or perhaps you're assigned to something at home. You're able to work remotely and minimize your exposures that way. There's a variety of different things that can be discussed with the employer. But they're going to have to understand the need for the accommodation, and a worker is going to have to engage the employer in those discussions.
Thank you, Blaine. So I believe, Blaine, you have question we have pre-received prior to the section. So would you like to answer it?
So the first question?
That was the one, let me see. I could share from here if you want me to.
Sure. And then, Tiffany, I think we should take them to the MFLOHC webpage so they can see the COVID resources that have been developed and
oh, okay. Sure. Do you want to do that? There you go.
You can.
Ooh. For the OHC web page, this is something wrong of my screen here. There you go.
There we go.
Yep.
So as Dorothy mentioned, there have been a bunch of resources developed, and thanks to Dorothy for participating in the development of those things. So if you go to the Occupational Health Center homepage, you'll see on the left-hand side of the page, there is a menu. Partway down that menu is highlighted COVID-19. That will take you to the resources that have been developed. So it will talk about many of the same things that we've been talking about, but there are also additional pieces of information there with respect to community sports, some of those benefits that are available should a worker find themselves away from work for whatever reason, and you're concerned about your pay. There may be some of those programs that government has recently released available to you. There are community supports, and again, the Occupational Health Center they work within the provincial boundaries. And so you can see they've identified a number of resources from across the province that can provide support to folks who are going through crisis as it relates to COVID or health concerns. You may be experiencing some symptoms, just what do you do? A lot of those resources are defined here on this webpage. So a great effort has been put into developing those resources and pulling them all together in one spot. So there you go. Have you been laid off work as a result of COVID? There are some, the CERB, Community Unemployed Help Center, Sarah Riel resources to help you. Some community resources here in Winnipeg.
One quick question. Are they also available in other languages? This COVID-19 resources that you are referring to?
Tiffany?
I think the government site have some resources they already translated into different languages. So I could send it to you, Monica.
Okay.
Yeah. So now yes, it's close to wrap up the webinar session because it's 6 past 8. So unfortunately, we cannot answer all your participant questions. But anyway, thank you. Thank you all of you for joining this session during the COVID-19, the difficult time for everyone. I hope you're all staying safe, healthy, and working safe. Whenever you are going to the community and go to work, make sure you protect yourself. Yeah. So the session is already recorded. So hopefully we're going to share with you really soon in the social media on our website. Then you could pass it on to anyone cannot make it for tonight. So once again, thank you all of you for participating in this session. And thank you, Blaine Duncan and Bernie Wood, to give us a great presentation and sharing your experiences and everything. Yeah.
Thank you.
Good night,
Thank you very much.
everyone. Bye.
Good night.
Bye.